Hi, this is Dr. Abdullah Khan, orthopedic surgeon, CarePoint Medical Center, Ras Al Khaimah. Today I will speak on the management of joint pains, especially knee pain. Majority of our patients who are having knee pain, the diagnosis is either osteoarthritis or internal derangement of knee, or very severe pain is because of infection in the knee, and the fourth thing is gout. Today I will speak on the role of diet and how to change our diet to reduce pain in the joint. I have already said that if somebody is having very acute severe pain in the knee and he is not able to walk, reasons are probably two. One is that there's an infection in the joint, and second is an acute attack of gout. These patients need knee support, rest, walk with the help of crutches. Don't take weight over these joints. Try to do some blood test to find out the level of inflammation. You have to go for certain inflammatory parameters. And antibiotics sometimes. If uric acid is very high, don't start with anti-uric acid medicines in an acute stage, otherwise pain will increase. Gout pains are very nicely responding to local steroid injections and probably proper knee rest with the help of knee immobilizer, braces, crutches. Don't do any massage, don't go for any kinds of activity. It's a different kind of pain, it's acute inflammation. In osteoarthritis, we suggest activity. In septic arthritis, we suggest rest. In osteoarthritis, I have already discussed that the inflammatory metabolic phenotype of osteoarthritis is very common these days. You need a different approach to deal with osteoarthritis, exactly like rheumatoid arthritis. You need to change the diet. You need to remove inflammatory dietary components, for example, fructose and omega-6. Low carb diet, ketogenic diet, Mediterranean diet, paleo diet is a proper dietary choice. Second thing, the most important thing is that you have to manipulate your gut biome with the help of probiotics, prebiotics, symbiotics. These things are going to help you. Then fasting is a very, very important component in your treatment modality. Fasting of 16 hours, you can eat, you can do feasting for 8 hours, and 16 hours completely fasting will bring a dramatic change in your symptomatology of osteoarthritis. Very, very important. Intermittent fasting. It is going to affect your insulin resistance. It is going to affect your gut dysbiosis. It is going to bring down all the inflammatory parameters and markers in your blood. It will help you a lot. You have to make intermittent fasting your lifestyle. You can do like this, that 2 days you are doing fastings and 5 days you are eating. Or maybe every day for 16 hours fasting. And there's so many regimes of intermittent fasting you can practice, but it has to be lifelong. It will affect positively your entire health, which is causing all the inflammatory metabolic diseases. Very, very important. Exercises will depend on your age and your activity level. There's no need at the age of 60 to go for high intensity exercises, which will maybe adversely affect you. A person who is having a severe pain in the knee and having some kinds of infection, inflammation, if he is going for a high intensity exercise program, probably it will affect adversely. It is not going to help you. Pain management is very important. Pain management should be done with the help of medicines, vitamins. Vitamin D is anti-inflammatory immunomodulator. It has no side effects like non-steroidal anti-inflammatory drugs. There are a lot of studies which are proving that if your vitamin D level is low, your consumptions of analgesics will increase. To try to bring down, you have to optimize the level of vitamin D, B12, magnesium before you start non-steroidal anti-inflammatory drugs. There are some patients I have seen they are using opioids. The consumption of opioids can be reduced if you are using vitamin D level, and try to optimize level of vitamin D, which is very, very important. You always see that vitamin D in most of the laboratory reports, it is written 30 to 100 nanogram is a range, and people, they have 35, they feel it's okay. No, it is not okay. Optimum level should be around 75 to 100. If your level is from 75 to 100, your immune system will work normally. Vitamin D is an immunomodulator. Vitamin D is an anti-inflammatory drug. You have vitamin D, a hormone which is not causing any problem to your GIT system and simultaneously reducing your inflammation. The most important thing in the pain management is optimizations of level of vitamin D, B12 and magnesium. And then of course you can go for topical patches, you go for non-steroidal inflammatory drugs, and in severe pain, of course, sometimes opioids are used. In some patients, viscosupplementation along with PRP is done. It is giving good results. There are some other modalities in osteoarthritis knee which I will discuss later. Thank you very much.